Hello again. This is Dr. Robert Chao reporting for Room Now from EULAR 2021. Today, I'd like to share with you two interesting abstracts on imaging and spondyloarthritis. The first abstract is poster 0037. Although this was a negative study, I thought it was a very interesting, very unique concept. And the question they posed was, does imaging of the sacroiliac joint in patients with undiagnosed back pain differ in those who present with psoriasis versus those who present with acute anterior uveitis versus colitis? 240 patients were included, all of which were less than 45 years old, all of which had at least 3 months of undiagnosed back pain and subsequently had MRIs performed. Eventually, 42.1% were diagnosed with axial spondyloarthritis. And like I said, unfortunately, this was a negative study. So there was no significant difference in unilateral versus bilateral sacroiliitis. There's no difference in the frequency versus type of sacroiliitis. Furthermore, there's no difference in grade, unilateral bone marrow edema, erosions, sclerosis, fat metaplasia, and even iliac versus only sacral distribution. So from this study, we can say that MRI findings of sacroiliitis in psoriatic axial spondyloarthritis appears similar to axial spondyloarthritis associated with iritis and colitis. And I think this study supports the umbrella term of axial spondyloarthritis. The other abstract is poster 0035. And this abstract is one of those that we see every so often that constantly reminds us that we need to use what we already have, and we don't always have to order that next image, that next MRI or CAT scan, and expose our patients to an additional radiation or have more of a headache with trying to get the next MRI approved by their insurance companies. This abstract tried to identify sacroiliitis in patients with inflammatory bowel disease who had CTs of their abdomen and pelvis for non-musculoskeletal reasons. 301 patients with inflammatory bowel disease were identified who had self-reported back pain with, again, onset less than 45 years of age. Out of the 301 patients, 60 of them, so roughly 1 in 5, with inflammatory bowel disease actually had CT evidence of sacroiliitis. Out of those 60, 11 eventually had axial spondyloarthritis. And out of the 60, 3 were actually previously undiagnosed. So again, this reinforces that we don't always have to find a new coolest imaging. We should look at the data that's already available to us. And we know that inflammatory bowel disease patients have a correlation with axial spondyloarthritis, but it's up to us to go and find them. So thanks for tuning in. This is Dr. Robert Chao reporting from EULAR 2021 for Room Now. And feel free to follow me on Twitter at Dr. RBC. Thanks.